Hi, this is the second part of our series on managing children who have fallen and have got a cut. In the first part, we dealt with how to be prepared for the eventuality when your child will fall and suffer a cut. Now the inevitable has happened and your child has fallen. Watch on to know exactly what to do and in which sequence so that you suffer less anxiety and your child receives the best care. As soon as you see your child has been injured, the first thing you do, don't do anything else. Please apply pressure directly onto the injured part. You can use a wet, clean cloth. You can use wet cotton, or if you have that emergency kit ready, then sterile gauze. Direct pressure controls almost all bleeding. There is no bleeding which cannot, even from major vessels, if there is a bleed, it can be controlled with direct pressure. So just apply pressure, look at the clock, keep the pressure on for 5 full minutes. 99.9% of all bleeds will stop. Once blood stops oozing or spurting, you will be at rest, you will be at ease, you will be able to take good decisions. After putting pressure and the bleeding has stopped, now is the time to wash your hands, dress the wound. Again, if you have a cleaning solution, a simple soap solution or Savlon does fine, or even betadine solution or Vocadine solution. Apply an ointment, apply a gauze piece if you have one, or just cotton, and secure it with a tape. Now is the time to fuss over your child, hug your child, wipe away her tears, call up people. But since you have been prepared, you have done all the right things and then indulge in this fussing. Most parents tend to do it the reverse way around. They allow the bleeding to continue while they try to quieten the child. Now, you should know exactly when you need to go to the doctor. I suggest that you see your pediatrician or your pediatric surgeon at your convenience if the bleeding has stopped and you have dressed the wound as I have recommended. But you may need to contact your pediatrician or pediatric surgeon or go to the nearest hospital casualty if bleeding doesn't stop despite 5 minutes of pressure, or the bleeding has stopped with pressure but starts again. The child is continuing to have pain which looks disproportionate to the injury. Here you need to be careful. Children are different. Some children will be very spoiled. Even if a significant injury, they are fine, they just shrug it off. And some children with the slightest injury will start howling. So if you feel your child is having and responding as if the child has significant pain as a proportion to surgery, you need to see there may be an underlying fracture, there may be some other injury, and you should consult on an emergency basis your known doctors or go to the casualty of the hospital. Now, it is very natural for the child not to move the part because obviously that is an injured part. But you should, if the child continues to keep that part immobile despite a reasonable interval, that may be again a sign that there may be something significant and you should seek relatively urgent medical attention. Then, of course, your intuition is the most important part. You feel that your child is not doing well. You are the one who knows your child the best. So if you are uncomfortable about how your child looks or behaves, seek urgent, early medical attention. Now, if the child develops symptoms which are totally unrelated to the injury, for example, vomiting or severe headache or any other alarming symptoms, then again, you need to see your doctor urgently. If you find the injury is on a cosmetically significant area, for example, the face, the hand, the genitals, or functionally or cosmetically, or on the soul, then again, it is better to consult your doctor early. The injury is on the chest or the abdomen, then again, it is better to take an opinion. A few days later, you have managed your child well, you have been doing kept it covered nicely with band-aid or without band-aid or with a sticking tape, and you find that after a day or two, there is significant swelling there, redness, or even discharge which is oozing out of the injured area, you may need to see your doctor. And suppose the scar had healed. Now, normally the scar is slightly elevated at the injured area and remains so and there is some swelling around the injury. This is because blood and fluid accumulates there, and it is completely normal. It is a body response to the injury, and slowly the fluid gets absorbed back into the system and the swelling disappears. But if you feel that the scars are raised, red and very itchy, even more than a month after the injury, then you need to seek not an early opinion, but electively you need to see your doctor, as your child may have a condition called as hypertrophied scar. This is a genetic tendency of excessive scar developing, and there are nice treatments available which will help in controlling the excess scar. If you have any doubts, questions, please respond in the comments below. My email address is info@nathaniclinic.com. It is there on the screen. Feel free to ask your questions there or in the comments below. While we do monitor this site, you may get an answer of this is not meant as an emergency, but we try and do our best to respond to each and every comment or question. Please also indicate what else you would like us to cover that you feel is important to your child's health. I hope you are wiser and spread the wisdom around to your colleagues, friends, relatives. Bye.